Joining us today. I know some people are still getting on the call, and I apologize that I sent out the incorrect call-in information earlier, so hopefully folks got my email with the correct call-in information. But we have quite a nice little group here in D.C. Thank you to everyone for coming and joining us in our office. Today we have Piper Largent with the National Association of School Nurses, and she's going to talk to us more about the Nurse Act. Megan Gordon-Dawn is joining us on the line, and she's going to talk to us about the Medical Nutrition Equity Act. And Every Life Foundation's Steve Silvestri is going to give us an update on the Labor, Health and Human Services Appropriations Bill, which was just marked up in committee this week. And then I'm going to give a little update on Rare Across America, which registration just opened up. So I'm going to hand over the controls to Piper, and she's going to take it away.
Thank you.
Can I there? Actually, over there. That's okay. Right there. Oh, I went too far. All right. There.
Technical difficulties.
There we go.
Okay. Hello. My name is Piper Largent, and I am the Director of Government Affairs for the National Association of School Nurses, or NASN, and I'm here to discuss NASN's signature legislation, the Nurse Act. Oops, I'm off there. If I can.
There you go.
I'm clearly having help here. Okay, so I'm trying to go into a few, before I go into the bill, give a little bit of background, and I pulled 3 of my favorite statistics. There's many, many more. But between 15 and 20% of children have a chronic health condition. NASN uses this number, and it's actually a little bit on the conservative side. I've seen numbers as high as 27, 28%. And of course, this is asthma, diabetes, seizure conditions, food allergies, just to name a few. School nurses spend 32% of their time on mental health issues. That may come as a surprise to some people. For every dollar spent on school nursing services, it saves $2.20 in medical costs and lost productivity for teachers and parents. We're not quite centered. But I call that a good return on investment. I know I'm speaking to the choir here because I'm sure that the parents of your children know firsthand the value of their school nurse and all that he or she does for children and their parents. So if we were going to discuss a bill to fund more school nurses, I thought we should also mention how school nurses are currently funded. And as most people know, most education funding is done at the state and local level. And indeed, the majority of school nurses are funded by education dollars, which are regular and special education funds. There are some other revenue streams, such as health departments, hospitals, local organizations, and state and federal organizations. But the vast majority of school nurses are funded by education dollars. So how many school nurses are employed nationwide? 39% of schools employ a full-time school nurse. 35% of schools employ a part-time school nurse. And 25% of schools, sadly, do not have a school nurse at all. And that middle number of 35%, that can vary wildly. That can be 1 or 2 hours a week, once a week, or 5 days a week, almost full-time, 5 hours. And also that full-time number, while a nurse can be full-time. She or he can have 2, 3, or 4, 5 schools under their belt. So if a child has a chronic condition, they need to time and attack well to make sure the school nurse is there. And these statistics come from NASA's workforce study. It is NASA's position that to optimize student health, safety, and learning, a professional registered school nurse should be present all day, every day. Clearly from the numbers that I just showed you, we are a long ways from this goal. Additionally, AAP, the American Academy of Pediatrics, also supports and endorses having a registered school nurse in every school building all day, every day. School nurses operate in what's frequently called the hidden healthcare system. After all, most people don't think about healthcare happening at school unless you have a child with a chronic condition or a rare disease. Or unless your child suddenly has a broken arm or a concussion, you just don't really think about the school nurse all that much. Or you take for granted that there is a school nurse. But for about 10% of kids, particularly those in the lower economic tier, the school nurse is their main healthcare provider. So the Nurse Act. Nurses for under-resourced schools everywhere, the Nurse Act. And it was introduced just yesterday in conjunction with National School Nurse Day. And since it was just introduced, I don't have bill numbers to give you yet. They haven't populated yet, since it's such a new bill. Next slide. Oh, good, you have problems too. And these are our congressional champions, Senator John Tester from Montana and Representative Dinah Titus, and they have introduced this for us before, and they've done yeoman's work on this. So what does the Nurse Act do? It's actually a really simple bill, and it gives grants from the Department of Education to local school districts to fund school nurses where there is not already a school nurse. It targets high-need districts, Title I or high-poverty districts. There's a 75-25 cost share between the Department of Education and states or local school districts. The life of the grant is 5 years, and it's hoped that this grant will essentially be seed money to local schools and school districts, and that after the life of the grant has elapsed, that then the school districts will find money in their budgets to continue to fund a school nurse. The Department of Education is required to evaluate the effectiveness of the grant program and to evaluate the impact of the school nurse on school health and on academic achievement. So what happens next? Now that the bill has been introduced, we will be having a virtual Hill Day towards the end of the month, and we will be asking our members to tweet, email, and call their members of Congress. And through another coalition that NASA is involved with, we will be doing a letter writing campaign of support. So we are looking to build support for this legislation. So that's really where we're at. Does anybody have any questions, either here or on the phone?
Great.
Okay.
All right. Well, thank you so much. I appreciate it.
And then I have my contact information.
Perfect. So if anyone has any questions or needs more information, they can definitely contact Piper. She's located here in D.C. with the National Association of School Nurses. Her email address and phone number listed right here on the website.
Please feel free to reach out. Thank you for the opportunity to present to you all.
Thank you so much. Now, let me see if Megan is on the line. Let's see. Megan, the line is, oh, there she is. Hold on one second. I apologize, everyone, for your patience. Thank you. Excuse me, Megan. She's
right. Down. Down.
Oh, everyone has better eyes than I do.
All eyes are on you.
Yeah. Let's see.
Megan? All right. Alrighty. Megan, can you? No. Okay. As always. All right. Thank you for bearing with me. Let me see if I can try one more time to get Megan unmuted so she can join us. All right. What I'm going to do is I'm going to unmute the phone line for everyone so that Megan
to keep
can
their troops
share
up to date
and
and so on.
So I just unmuted
Hello,
the line.
everybody.
So everyone can mute their phones so that
Wondering how many
Megan can
other
have the
people
floor.
were wondering whether it's worth it. The one thing they did last year
I am
that
happy to
really
try to talk
turned out
over the people that
very
are
well
talking.
was lobbying the district offices during the summer recess for Congress. And
or maybe not.
I'm trying
the
to.
local offices
where that
of
is.
the members of Congress. So they had people are patient advocates.
Shannon, is there
or
any,
patients
was there something
go
I was supposed
to
to
the
click
district
to
offices
be able to?
to
Yeah, when you
get
call
acquainted
in,
with the members of
when you
Congress
log in on the
and
line,
pitch them on the
it
bill
says I'll
that the
call
group
in, and you
is
click on
presenting.
that, and it has the phone number and the
mostly,
call-in information and the
introducing
attendee
yourself
number.
and
Got
letting them know your constituents.
Okay, do you want me to
this is
hang
what
up
your
and try calling back
constituency
in?
looks like.
Sure, and
And
we'll
they were
go
able
ahead
to
and have
print out
Steve
300
present, and then we'll go to you.
who
Okay.
did that.
Okay.
Where?
Sorry
in
about that.
August.
Absolute
Okay.
chaos.
All right, no,
Nobody's
So
muted.
I felt like
Let's
that
see.
was worthwhile.
Oh. All right. So now we have it quiet here, and I'm gonna pass it over to Steve, and then we'll try and find Megan again when Steve is done.
Thank you, Shannon. So this is Steve Silvestri here with EveryLife. I'm going to be going through some highlights from the fiscal year 2020 Labor, Health and Human Services Education Appropriations Bill. This was marked up by the subcommittee a week ago, and it was marked up by the full committee yesterday. The report, the bill, and the summary are all available on the Appropriations Committee's website, should you want to go find any more details. But I have gone through the report and highlighted some things that are important to the rare disease community that we'll go through right now. So as we're going through, if you see something that you want to thank members of the subcommittee for, or something that concerns you and you want to raise with members of the subcommittee, this is a list of the full subcommittee that worked on this bill, members from across the country. If one of them is your member of Congress, please either thank them or share concerns with funding levels that are in the bill, because they'll want to hear from you and certainly have a very outweighed influence on what's in this bill over a typical member of Congress, because they are on that subcommittee. As I said, the full committee marked up the bill yesterday. The president's budget was released in March. That's really the first step to the appropriations process. It gives Congress the opportunity to review the recommendations that have been made by federal agencies for their budgets. Then they'll bring in the heads of agencies and departments. So members from NIH, including Director Collins, testified before the subcommittee justifying their budgets, and that all happened during March and April, the same time that the deadline was for everyone to submit their requests. There were over 15,000 requests submitted to this subcommittee for this bill. And in June, we're hoping that it will be considered by the House, but that always differs depending on when they can reach agreements. And then we need a bill to be signed into law before the end of the fiscal year on September 30th, Otherwise, there will either be a government shutdown or a continuing resolution which will just maintain all the current funding levels, and none of the changes in this bill will come to fruition. So in the bill, generally good numbers for the Department of Health and Human Services and a lot of health programs, including a continuation of increased funding for the National Institutes of Health. Many of you probably remember that last year there was also a $2 billion increase, so this is building upon that. The National Center for Advancing Translational Sciences received a modest increase, as well as the National Cancer Institute and the National Human Genome Research Institute, which are all doing a lot of important research relevant to rare diseases. If you look through the summary and the report, it will give you information on increases for all of the different institutes at the National Institute of Health that may be relevant to specific conditions and rare diseases. There's also funding that was authorized by the 21st Century Cures Act, which I know a lot of people on this call were involved with getting enacted. That includes funding for the Cancer Moonshot Initiative, significant increase for the Precision Medicine Initiative, as well as continued funding for the Brain Initiative, and an $8 million funding line for regenerative medicine. And those are all funding lines that were made possible by the 21st Century Cures Act. Also, newborn screening has some of the highest numbers for these programs ever. That's thanks very much to Congresswoman Roybal Allard from California and Mike Simpson from Idaho. For those of you following the newborn screening reauthorization, these programs need to be reauthorized by the end of this fiscal year. So Congresswoman Roybal Allard and Mike Simpson both introduced the reauthorization bill, and it's fortunate that them being on the Appropriations Committee in senior roles also allows them to influence the funding levels for a lot of these programs in the appropriations bill, and that's why we've seen some significant increases, which we're hoping will be maintained going forward, because a lot of pushback from states to screening for more conditions is often funding related, and this federal support helps them in being able to screen for more conditions and get more conditions added at a faster pace. Some additional programs that I know we've been following, there at HRSA, there's maternal and child health program, which focuses on sickle cell disease. There was an increase there, as well as funding continued for the ALS registry at the CDC. And over at ARC, there was a doubling of funding for diagnostic medicine, which is, for many rare disease families, something that is a challenge with getting that accurate diagnosis. It can take many years, and we're happy that there's been some increased focus on making sure that there's adequate funding at agencies like HRSA and ARC to make sure that primary care physicians and specialists have a better understanding of how to diagnose these rare diseases. There's also some great report language on the rare disease front. So if you go through the legislation and the report, it's I would recommend just Control F and look for a specific condition or disease or disorder that is of interest to you. But this is some highlights of what was in there. There's been, for the listed conditions here, the committee giving guidance to NIH for increased funding, requiring a minimum number of grants that have to be given in some cases, asking NIH to prioritize, looking at specific rare diseases. And, while funding is not always tied to the report language, it is a great way to help push NIH to looking at research more for certain conditions, and something that if your organizations haven't been involved in is often kind of an easier lift than getting dedicated funding if you wanted to get more involved in advocacy on the appropriations front, either in the Senate, which is still moving through their bill and that hasn't been introduced yet, or next year if it's something that you can prioritize on the advocacy front. There's also some language on gene therapy. This is something that everyone's talking about right now, all of the optimism and possibilities that come from this advanced science. I think that the Appropriations Committee understands the need for regulation to catch up to the science, so they had some language in there, and I kind of cut that down. They had some much longer paragraphs if you'd like to go take a look on gene therapy, making sure that, all the agencies relevant to healthcare are keeping up with the pace of that scientific innovation, which I think is some good news for our community. And lastly, those of you following our request for a rare disease burden study, we had requested a $1.5 million funding line for a National Academy of Medicine study to look at the total cost of rare diseases to the economy, the taxpayer, to society, the patient, the family, the caregiver, so that we could really better understand what is the cost to the United States of rare diseases. Unfortunately, we were not able to get funding for this study in the House bill. We are still pursuing it on the Senate side, so if this is something that you've been helping to advocate with us for this, please don't get discouraged and continue to reach out to your senators. If it's something that you have not been involved in and want to get involved in, there is still time to try and get funding for this study included in the Senate's Labor, Health, and Human Services Education Appropriations Bill. So feel free to reach out to Shannon, who can connect you with me, or if you have my information, reach out directly to me to get more involved on that request. And that's it from me.
Great. All right. See if we can get Megan on. Megan?
Yep, I'm here.
All right, awesome. Take it away.
Great. Well, thank you for having me this afternoon. So the Medical Nutrition Equity Act was reintroduced last week, and the new bill sponsors in the House are Congressman Jim McGovern, Democrat from Massachusetts, also the Rules Committee chair, and Jamie Herrera Butler, Republican from Washington, continued on from the previous Congress. So the new bill number in the House is H.R. 2501. We are expecting the Senate reintroduction soon. Senator Casey will again be the Democrat lead, and we're in the process of getting a new Senate Republican lead, as Senator Grassley had to take a back seat on this since he is now chairman of the Committee of Jurisdiction for the bill, of primary jurisdiction. So the language of the House and Senate bills will be identical. There are a few minor updates from last year. First of all, the bill has added to TRICARE immunoglobulin E or non-immunoglobulin E medicated or mediated food protein allergies to the list of covered conditions. It creates a floor of federal coverage for medically necessary foods and vitamins, and does not supersede stronger state laws. And it clarifies that insurers cannot limit coverage of medically necessary food or the medical equipment and supplies necessary to administer the food when prescribed, ordered, or recommended in combination with other medically necessary food or other necessary medical equipment and supplies. So other than that, it was just updating the title to Medical and Nutrition Equity Act of 2019. Since this is a new Congress, we have to rebuild the co-sponsor list again. As we rebuild, one issue that continues to be important is that we have bipartisan support, which means as close to an equal number of Republicans and Democrats as possible. In the House, we are perfectly bipartisan as of right now. The bill was introduced with Congressman Brian Fitzpatrick, a Republican from Pennsylvania, and Congressman Joe Kennedy, a Democrat from Massachusetts, as original co-sponsors. So right now it's in perfect balance. We realize it's unlikely to stay that way, but we do need to keep it as close as we can. So those of you with great Democrat connections, maybe if you also have connections on the Republican side, this is a great opportunity to focus on the Republican side. The Patients and Providers for Medical Nutrition Equity Coalition had their Hill Day on Tuesday. Approximately 100 people traveled to D.C. to meet with their elected officials, and we had a training session on Monday, and then went to the Hill all day on Tuesday and had approximately 230 meetings with senators and representatives. We're still in the process of following up from those meetings, so I expect more co-sponsors to be added. But right now we have 4 House Democrats who have agreed to co-sponsor from those meetings, and that's Congressman Andy Levin, Democrat from Michigan, Gwen Moore, Democrat from Wisconsin, Ron Kind, Democrat from Wisconsin, and Jamie Raskin, Democrat from Maryland. Since these are all Democrats, the sponsors are going to hold off dropping their names to make them official co-sponsors to see if we can get a few Republicans to balance this list out. So again, if you have Republican connections to any representatives, it would be a great opportunity to reach out and try to get them to co-sponsor HR 2501. So we have 2 action items right now that I would encourage everyone to participate in. First, we really, truly need your stories. If you have or represent a condition that is covered by the bill, please go to nutritionequity.org and put in your story. Those stories then get filed by state, and we pass them on to members of Congress. So they are extremely helpful in helping to make the case for the legislation. Also, there is a action alert on the website. Again, it's nutritionequity.org, and asking members of Congress to co-sponsor the bill. So that's really it for the update that I had, but we greatly appreciate the help and assistance of everyone in the broader community represented by the conditions covered in the legislation, and are really looking forward to moving this legislation this Congress. That's it.
Great. Thank you, Megan. I attended some of your events this week, and they were great. So thank you for all your hard work on that.
Thank you.
So I wanted to kind of give a quick update on a few things related to RDLA, the Rare Disease Legislative Advocates. So one thing I kind of wanted to give an update to those patients or organizations that may be new to RDLA, or even just to remind you of some of the resources that RDLA provides to the rare disease community. RDLA, as many of you already know, we're a program that supports rare disease patients and organizations across the country in regards to their policy and advocacy work. And we have a number of resources that we have available to advocates and organization leaders across the country who maybe don't have some of the same resources available at their fingertips that we do here in DC. One of which is our online advocacy tools that are used to contact members of Congress, our monthly newsletter, which is sent out with action alerts, advocacy, policy events, and other news, consulting on legislative strategies and your advocacy-related events. We have office space here in downtown DC, and we also have a congressional scorecard on rare diseases that is available on our website that you can use in contacting your members of Congress and show them how they're doing on rare disease issues. So specifically, our online advocacy tools, this year RDLA recently acquired a new online advocacy tool called Voter Voice, and with Voter Voice, we're able to offer the rare disease community the opportunity to use the system to launch federal and state campaigns using our system, which would include the action alerts that can be customized for specific states, committees. You can use it for federal policies as well as just a state policy in your own state. And then we can also, once you have done a campaign using the Voter Voice system, we can make sure to provide you with the metrics on the members of Congress who were contacted, how many actions were taken, so that you can know how well your efforts went along the way. If you find yourself in need of any assistance, if you're working on a bill or any other policy or legislative efforts, please contact me, and I'm happy to help you along with the process. And that is, anytime that you need those services, feel free to reach out to me. I also wanted to announce that registration for Rare Across America has opened just yesterday, and we already have over 80 registrants to meet with their members of Congress this summer during the August recess. Rare Across America, if you're not familiar, used to be called our in-district lobby days, and they're meetings in the local district offices during the August recess. And they're a great opportunity to meet with your members if you're unable to travel to DC, or you just are getting more involved in advocacy work. This is a wonderful opportunity to start a relationship with your legislators. So registration is open. It'll be open until July 3rd. And you can register at rareacrossamerica.org. And like Rare Disease Week, we'll provide an informational webinar with information on what to expect in your meetings, how to have a successful meeting with your members of Congress and their staff. More information on legislative asks will be available on July 5th. Of course, we RDLA schedules all of the meetings with your members of Congress. So all you have to do is register and then wait for an email that tells you when your meetings are scheduled and where they will be held in the district. And the meetings will take place during the summer recess, as I mentioned, between July 29th and September 8th. And if you have any questions, you can feel free to reach out to me as well at my email address listed there at the bottom of the page. So our next RDLA meeting is scheduled for Thursday, June 13th at noon. And if you have any topics that you're interested in presenting on, or a topic that you'd like to learn more about, please feel free to reach out to me. The agendas for these meetings are always open, and so we're always looking for people to speak and different areas to be covered. So please reach out if you're interested in presenting or speaking on one of our webinars. We would love to have you. And thank you so much. I think that's it for today. But thank you for everyone for joining us, and I look forward to speaking with everyone again next month.